Um, Hi, my name is Anna K. White, and this is my second video to Nursing Fundamentals final video. For this video, I will be doing IV piggyback medication administration. This first part of the video will be technically done in the medication administration room. And the first thing to do is to perform hand hygiene. And I perform my hand hygiene, and now we'll be checking the patient's MAR to verify the patient's name, date of birth, allergies, and what will be done today exactly. So after looking at my MAR, I have read that I will be administering 500 milligrams of vancomycin per ml to this patient. And this is to treat a urinary tract infection according to lab values, urinary analysis, and CBC results. So to continue on, I will go in and get my medication for vancomycin. Now, because this is a IV fluid mixin, I have to check the compatibility of vancomycin to the other IV fluids the patient's already on. And according to the MAR, the patient does not have any incompatibility with MS or LR. So now I'm going to move on to the medication preparation. So now moving on, I'm going to be doing another check of the MAR to verify patient's name, the date of birth, the drug, the medication, the dosage, and the frequency. And as I stated before, it is 500 milligrams of vancomycin per ml. And it's in a reconstitution order. Okay? So now I'm going to perform hand hygiene once again. And I'm going to don on my gloves. Okay, so I've gotten the medication out of the cart. And they're all assembled in front of me here. I am going to check vancomycin for the expiration date, making sure that it is actually 500 milligrams, which it is. And I'm going to check for expiration date, clarity, and color for both. And so far, so good. I'm also going to have a bottle of pouch of normal saline, my 2 syringes, and for aseptic techniques, I'm going to have alcohol wipes. Okay, and my piggyback sodium chloride pouch, which I mentioned. So before I continue, I'm going to do a quick medication calculation to know exactly how much normal saline I will be putting into my vancomycin for my reconstitution. So according to the order and on the bottle and the calculations that I've done, I'll be inserting 5.6 ml of normal saline into the vancomycin for a total of 6 ml into the container. Then after that, I'll be using my other syringe to withdraw 1 ml of the medication and insert that into this pouch, which will now become my piggyback, which I will bring to my patient room to administer. So now going forward, I have the syringe here. This is a 12 ml syringe, and I'm going to uncap, pull in air to 5.6 ml. And before I start, I'm going to perform aseptic techniques. Separately. One, and I'm going to now insert the air, and like I said, it is all right. So I'm going to pull in the correct amount of solution. Just making sure it's the correct amount in the syringe. And that's going to be 5.6 ml of fluids. I'm going to put it into my vancomycin, which I've already cleaned. Now I'm gonna recap this and then put it into the sharps bin for safety. Okay, so with this medication, because it is a powder reconstitution, we cannot shake vigorously, so I would palm roll slowly until the medication is even. So just a few more seconds, about 30 seconds. Everything looks good, it's dissolved, diluted. So now I'm going to take out my second syringe. I'm going to withdraw according to the MAR. I'm going to take out 1 ml. I'm going to aspirate. Okay, I'm going to put in. And I'm just making sure that we do have the correct amount in here. Okay. Now I'm gonna just put this back down, recap for a few minutes. Now I'm going to perform another aseptic technique, which is now to clean off the IV piggyback port. I'm going to clean the white part. Okay, making sure it's nice and clean. And this is on a nice flat surface. I'm going to then uncap my medication, doing one final check to make sure it's the right patient, time, medication, dose, and frequency. And I'm going to insert it into the port. And now I'm just going to recap and discard this into the sharps container. All right, and then I'm going to write the patient's name, date of birth, the drug, the amount, the dosage, the time, the frequency, my signature. And I'm going to put this away from the label so they can actually see what it is. And the medication name is still visible. So now I'm going to take my gloves off and perform hand hygiene. And I'm going to take this medication to the patient's room. So I did wash my hands like I mentioned before. So now that I'm at the patient's room, I'm going to introduce myself again. My name is Anna Kay. I'll be your nurse for today. Before I continue, I'm going to do hand hygiene once more. And I'm just going to tell you why I'm here today. So today I'll be administering IV piggyback solution of vancomycin, which is an antibiotic medication. And this is to treat your urinary tract infection. This is going to be due to the report in your urine analysis and your blood culture and CBCs. Okay? I did actually for your name and your birthday. Thank you for verifying. So some side effects of the medication is nausea, vomiting, and rashes. If this does occur, please notify me immediately so we can get it rectified. All right, so before I continue, again, I'm gonna check against the MAR, make sure that I have the right name, again, the right medication, the right frequency, the right time, the right amount, and the right patient. All right. Okay, so now I'm going to assess the patient's existent IV lock. I'm just going to make sure that the site is not edematous, redness, tenderness, or painful. And at this point, I'm going to don on my gloves again. And I'm going to do additional 5 rites. And patient education, assessment, evaluation, documentation, and the right to refuse. And are you okay with this? Okay. So we already established what the medication is for. It's an antibiotic to treat your urinary tract infection, okay? And so now I'm gonna just move on. So now I'm gonna then remove the protective cover. I'm gonna have the solution lie flat, which it is. And while I was in the medication room, I made sure it was distributed evenly, but I'm gonna do it again just to make sure, and that is all diluted into the piggyback. I'm then going to remove the blue protective covering from the pouch, and I already cleaned it. And I'm gonna attach the IV piggyback link to this. Now it's connected. I don't know if you guys can see that, but it is. And then I will make sure before I move on, because this is a new tube, that I'm going to clamp it shut. And that's very important. Okay. So it is clamped shut. I am going to prime the tube now by letting some flow down in order to make sure there is no air bubbles. Now I'm going to hang the piggyback pouch, higher than the current IV drip that's going on currently. Okay. So another step for this would be another step is for the Y port. I'm going to wipe off the Y port that's connected to the patient, making sure that aseptic technique was done. So in this case, we don't have one, so I'm going to just let you know that I did it. I'm then going to set my drip rate to 100 ml per hour. And then I'm going to then unclamp. This was connected, by the way. I unclamped. Now, once I've done that, my infusion rate is set. The communication is at the top, and the other one is still below. And then at this point, I think I'm finished. So I'm going to provide hand hygiene. I'm going to clean up the area. I'm going to document, and then I'm going to ask the patient if he's okay and if everything is okay, and I'm going to give him his call bell and everything else, and everything is set, and I'm done. So thank you very much.